it's crazy how a lot of our childhood just shapes us into who we are. And I know that there's a lot of people that struggle with childhood trauma and they don't necessarily know how to process it. So when somebody comes to you in your practice, like what does that look like and how do you lead them to a role of like stepping into this new version of themselves, processing their emotions, healing? What does that look like for you and for your patients?
Yeah, I would say it happens in different ways. Sometimes clients will come into therapy because they want to deal with the situation that's happening now in their adult lives. But then as we talk, lo and behold, there's all this childhood stuff that's also there that perhaps needs to be worked through. So sometimes I get people in the door because let's say now they want to deal with a breakup, for example, or maybe a really challenging or toxic relationship. And so we're able to sort of connect the dots and understand that there are patterns from childhood that maybe led to instances of what's happening in that toxic relationship now. So that's actually one way. Like the stuff happening now is a good entryway to what happened in the past. I would say other clients, they're just very open and very insightful and know, like, in my childhood, I experienced sexual abuse and I know that I really need to deal with it. It's causing me to feel depressed. It's causing me to feel anxious. So some people just are ready to kind of dive in. So there's really no right or wrong. Everybody has their own path and their own journey as to how they explore it. But I'm kind of someone that's always asking, like, so, where do you feel like that emotion comes from? Is there something that you can remember from the past? Or even when I ask a client about an emotion or a feeling, I might say, how old or how young does that emotion feel? Because oftentimes that emotion could be from an earlier childhood place. So we'll kind of notice, oh, like a childlike part is coming up for you right now. So there are different ways, but I think it just depends on everyone's desire and everyone's path.
Yeah, it's interesting how everybody's brain is so different because
Yes.
for me, I feel like I remember most of my childhood. I remember bad things that have happened. I didn't necessarily block it out, or at least I don't think I did. But it's interesting, and you can correct me if I'm wrong, but how some people just block out trauma and then others kind of remember everything and are outspoken about it, like you mentioned. But it's
Yeah.
it's very, very interesting how we are all so different in that regard.
We're also different. And I will say, like in that example that you just talked about, where people might block it out, that's totally a survival mechanism. That's literally like the part of the brain that's saying, I just want to get you through life to survive and to not be stuck in that time. So it's a good survival mechanism for the time being, but oftentimes it does catch up to people.
Right.
And people start noticing that other memories might come up, or like we said, depression might come up, or challenging feelings in the body might come up. So it is interesting.
I remember whenever I was going to a new therapist and I had gone to therapy. I unfortunately lost my dad in high school and never once went to therapy. It was kind of frowned upon and I think I really needed it, but I just didn't really have the support. So I ended up getting into this relationship in college and it like did not work out and I think it just opened up a can of worms. Went to therapy for the first time and it was super successful and I really felt like I was on this healing journey. And then I ghosted my therapist, which I'm sure is very common.
Tell me more about that.
Well, I got back together
Okay.
with that person and I think I felt a sense of guilt and I was shameful. So it wasn't until a few years later where I really got back into it and I remember just feeling so uncomfortable. And I was talking to one of my friends who has been in extensive therapy her whole life and I said, I almost feel like this isn't helping because like I am so uncomfortable and it's just like rehashing all of these things and I don't know how to move forward. And she was like, well, Veronica, I think if you feel uncomfortable, that means it's working. And I think my question to you is, those people that are blocking out those memories, do you think that like rehashing it and healing and doing the work is important? And I know that you're mentioning that, yeah, it's a survival mechanism, but how long can that survival mechanism last? Is it just a Band-Aid?
Well, that's the thing. I say we can all compartmentalize, but we can compartmentalize these challenging memories in the short term. Because in the short term, it works. If you think about it, you get through your day, you work, you get through life, right? But in the long run, it's really hard to compartmentalize because those emotions, the shame, those concerns, those fears, those memories really start to catch up. So I don't know if compartmentalizing in the long run really is honestly successful or even realistic. And so as far as rehashing, I think it depends because some people are okay with it and really want to just talk and just express themselves, and they want their therapist to know, like, this is what I'm going through, this is what I feel, this is how it's impacting me emotionally. And other people really have a hard time in that. So I often say, like, we rehash at your own pace.
Yeah.
Like if you can just tolerate just like 5-10 minutes of it in session, and the rest of the session you talk about, let's say, something else, like your job that you don't like, that's what we're going to do. I think as a therapist, I really try to be mindful of what can your nervous system handle, because if you were my client and you were in that toxic relationship, what I always say to my clients is, I may not agree, with every decision that you make, but I will support you no matter